Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At Blue Zone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit bluezone.health and take the first step towards stronger lungs and a healthier future. Blue Zone Health. Breathe better, live better. Hey everyone, and welcome back. We are on season 2, episode 2 of the Cozy Lung Lounge, and today we're talking all about asthma. So we're going to be going through some pathophysiology, risk factors, signs, symptoms, all sorts of stuff. So I'm excited to be here with Kelly and Gina, and I think it's going to be a really awesome episode.
Hi, everybody.
Hey, everybody. Pathophysiology is one of those things a respiratory therapist loves. And it's a big word for what's going on in the structures of, in our case, the lungs that are causing problems, and, you know, the anatomy of the whole thing. So we're going to talk about what causes asthma in those lungs, and what makes it really dangerous, because asthma can be life-threatening. So I'll defer to Kelly for the next description of this asthma.
All right, I'm going to pull up a picture. So those of you who are listening, you're going to have to use your imagination.
And for anybody who wants to, you can also watch it on YouTube. It comes out at 6 p.m. on the nights that the episode release. So especially for these episodes going through all of this different pathophysiology, please check out our YouTube page so you can see all of our graphics.
Please do. So on the left side here, that's a healthy airway. And on the right side, that's an asthmatic airway. So notice on the left, that smooth muscle, the darker brown around the outside, nice and relaxed, nice open airways. If you look at the inside part of the airway, this is a cross section of the airway. There's a basement membrane that's nice and clean, and the airways are nice and open. They just look healthy and happy. And when you jump over to an asthmatic airway, all those muscles start tightening and narrowing the airway. So air has a hard time getting in, but more importantly, air has a hard time getting out. So all that carbon dioxide that we talked about in the last episode, people with asthma have a really hard time getting rid of that extra carbon dioxide and getting oxygen in. And if you look at the basement membrane, is all kind of swollen, which narrowed the diameter of the airways here going towards the alveoli. And a lot of times within this narrowed airway, there's also a lot of secretions. So these people have not just double trouble, but triple trouble, really trying to move some air. So ladies, did I miss anything?
This is one of the features of asthma, the reversibility. And so you see it opens and it closes depending on the allergens that might be there. The test that I do oftentimes, the methacholine challenge, actually causes some of this bronchoconstriction during that test. But fortunately for asthma, it can be reversed in most cases. And that tightening in the airways can be relieved by a rescue inhaler. We talk about albuterol a lot in previous episodes. But the inflammation inside the lungs that she's talking about needs some other things to treat it. Particularly inhaled corticosteroids are what we use for asthma. And then the mucus, you need to get that out too. So there's all kinds of pieces to that asthma. But the biggest feature is it usually gets better and it gets worse.
And I think one of the important things too is there's different people respond differently when they have asthma. Some people have very mild asthma, so that constriction and that swelling only happens a little bit. And then other times it happens like in that graphic that Kelly was showing, where those airways nearly can close or will completely close. So I think asthma is something that a lot of people are like, it's just asthma. But it actually can be very, very serious. And this is a really important topic. And it really just depends on the person. So if you know somebody who has asthma, it's important to kind of know, especially if you're going to be around them a lot, how severe it is. Do they have medicine? And keep an eye out on them, especially if they have severe asthma, because this can be a very serious health condition if they have any triggers that happen while you're around them.
And make sure that
Oh,
you
yes.
yourself as a friend, that you're not a trigger. I have to tell all my friends, please, 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 when you come over or we go somewhere, no perfume. Not that I'm a horrible asthmatic, but I just have found over the years that when I get around perfume or air fresheners or things like that, scented candles, things like that, I feel my lungs just tightening up, just like in that picture. So if you have somebody that's a friend or family member, they're an asthmatic, just say, do you know your triggers? And I'll make sure not to wear the perfume. I'll make sure not to use the Downy Unstoppables. I'll make sure not to put, plug in 20 Glade plug-in air fresheners before you come over. So be vocal, stand up for yourselves.
Yes, because they're likely to say, "Oh, it's no big deal," but it really is a big deal, and people do die from it. And so when I was a young respiratory therapy student, that was my capstone project, was a near fatal asthma. This sometimes asthma comes on so quickly that you don't have time. One of my fellow podcasters, Linda Nozart, the asthma lady, really speaks on this. And that's how her career got started, when a grandma was taking care of their grandchild and they didn't have the right medicines on board and they just didn't realize the triggers. In my household, I've got a couple of asthmatics. My husband's been an asthmatic his entire life. And so he knows what controls him. And I could kind of tell with my ears, what's going on with him, whether he's tight or not. He tends to wheeze a lot when he gets an asthma attack. Now, my son, on the other hand, he has a cough asthma, and he coughs and coughs and coughs. He doesn't wheeze. His lungs are not too bad, but incessant coughing. And he has to treat his asthma that way. And so the triggers and the symptoms can be different for each person. So you'll want to know what's going on with each of those symptoms.
Going back kind of to the development of asthma, there's several different risk factors that can lead to developing asthma. So the first one is genetics. Like for me, my mom has asthma, my grandma has asthma, and so I have asthma. Now it's very, very mild, not as bad as theirs, but it can be passed down genetically. And then you have allergies. So having really bad allergies has been linked to the development of asthma as well. Are there any other things that you guys have seen out there that can be risk factors?
Something that's a protective factor. You talked about this where your asthma is mild and your mom and your grandma have a little bit more. I think my son has a little bit less taxing than his dad. And that is breastfeeding. Breastfeeding has been shown to actually improve that allergic response and have less asthma in kids that are prone to that.
I do know there's some other ones that can happen kind of in early development, and that is being exposed to different things. So as a child and as an infant, if you are exposed to heavy levels of smoke, if you are in a very polluted area, being around those for long periods of time, if you live in a household where maybe people smoke, you live in a place where there's lots of wildfires, or if you have experienced a really bad respiratory infection when you're really little, like RSV or a really, really bad bout of pneumonia, different things like that can lead to the development of asthma.
And a lot of times children with asthma can outgrow it at a certain point, depending on the type of asthma that they have. But also something that can trigger asthma attacks is a big life event. And if you have a huge life event, you may end up, even though you never had asthma as a kid, with symptoms just like asthma. For example, if you had COVID, I know that my lungs have not been the same since I got COVID back in 2022. Things like, depending on what you're exposed to, if you're exposed to a lot of chemicals, depending on where you live, it can trigger asthma-like symptoms, and they're treated the same way.
I've had some patients who say that they can't even laugh and have a great time with their family and friends because that will bring on some asthma symptoms. You might not think about it, but cold air is quite a trigger. So if you inhale that cold, dry air, you might have some shortness of breath. People with asthma may be particularly sensitive to aspirin. So you'll want to watch some of the things that you might also be taking with medication.
And some other triggers, another big one's physical activity. When people are up and exercising, especially if they're doing cardio or endurance exercise and they're really getting their heart rates up, they're breathing really heavy, that can cause exercise-induced bronchoconstriction, which is a little bit of a different form of asthma as well. So there's also different infections or just getting sick with the cold or the flu. Any little thing can really trigger your asthma. So what are the different symptoms that you guys normally see with an asthmatic?
Well, you talk about that exercise-induced asthma. If I have a good CrossFit session, I'm pretty sure going to be wheezing all the way home. And it'll take 15 or 20 minutes for me to calm down from that sometimes. And I don't have asthma, but there might be a little bit of that in there. But like I said, the wheezing, tightness in your chest, coughing, those are all those kind of things. Some people say it's like an elephant sitting on their chest, not particularly like a heart attack symptom, but just an overall heaviness in there.
Hi, I'm Kelly, a registered respiratory therapist with Blue Zone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better. Your breathing should be easy, and if you're having to think about your breathing, that should be step one for you. And if you have an asthma action plan, medications, you've talked with your doctor about what to do, that would be the time to do it. And I have a lot of patients who ignore that. And they say, oh, well, I was just doing this, or, oh, I was just in, a beauty store with a ton of perfume in the air, or, oh, I just went and got my nails done, so it's all the fumes from there, I'll be fine. But listen to that little voice, those little symptoms that are telling you, hey, you know what, I'm thinking about my breathing now, which I shouldn't be, which means I need to pay attention.
And those symptoms come on slowly and slowly, and you can't, it's not really a badge of honor to just say, I'll deal with it, I can handle it. Over the years or over months, it may get to where you just are used to the shortness of breath, but we really want you to report those symptoms as important.
Another trigger could also be having a cold, having a flu, right? Any kind of a viruses that are going around can trigger a flare-up of asthma. So stay away from sick people.
Much of the time when you have smoke, you don't know what's in it either. So we know what's in cigarette smoke. There's a lot of chemicals in it. Yesterday was Veterans Day as we were recording this. So happy Veterans Day, and thank you so much for your service. Many of my veteran patients that come in to see me have asthma brought on by Agent Orange and by burn pit exposure. So I've got a lot of young veterans with asthma from their service. And anything that you breathe in, whether it's a fire outdoors or, or inside your home, can be toxic. So, and trigger those asthma symptoms.
And so that's why we say, throughout your life, make sure you pay attention to things you're breathing in. Make sure you pay attention to those symptoms and those times where you're like, man, my breathing feels weird, but it's no big deal. I was just at the hair salon breathing in hairspray. Pay attention to all those kind of things and pay attention to your family history, because all of those can be really important information to bring to your doctor when maybe you start to realize that I don't think this is normal. I don't think that this shortness of breath or this breathing pattern is normal. So, and when you go to the doctor, they can perform different tests to really investigate and make sure that they give you the right diagnosis of asthma.
So you mean they're not just going to give you an inhaler and say it's asthma?
I hope not. That's kind of what they did to me when I was younger. I actually never got full testing. I worked in a pulmonary function testing lab when I was in college doing some research, and I have done some tests since then, and that's how I know. But the funny thing is, my doctor has never actually done it. I just started working in the pulmonary health world. And that's the only reason why I've actually seen my flow volume loop. I've actually seen the pulmonary function testing and seen what goes on in my lungs. And it's not something that doctors always bring up. So it's important to know about spirometry and know about these lung screening techniques. So you can ask them and just say, my breathing isn't normal. Please don't just give me an inhaler. Can we please get a test done to see what's actually going on?
Now, over the years, if you have asthma and you've had it a long time, you may have something called asthma COPD overlap syndrome. In that case, your asthma just doesn't bounce back like it used to. You also see that on spirometry. And so that's just something that if you had asthma a very long time and it's not been well controlled, it very well may go into the COPD and be less reversible.
And the great thing about a lot of the spirometry is they can test you before and after you take your rescue medication. So they can see what's going on with your lungs during some of that constriction. And then you can take that medicine and see in about 20-30 minutes how your lungs compare. And so they can actually look deeper into it and make sure that the medications that they're giving you are actually going to be helpful. And that's actually what's causing that shortness of breath. So that's why it's really important to do, to please advocate for yourself and to get that test done so you really have a concise and very particular answer on what's going on. So what other treatments are out there to help with asthma?
Biologics are a big one, and that's where your doctor really drills down and figures out what it is that's causing your problems and gives you something that will help you not react so severely to whatever that substance is. And
now, darn it, I did for biologics. I was trying to get my husband on those, so I sent him off to his primary care doctor and said, "Hey, primary care doctor, I'm confident in your ability to manage this with him and I all there together. But it sounds like for biologics, you may need to have a specialist on board and not just your primary care doctor to do that."
some other things you can do, just exercise and activity. And going back to the exercise-induced bronchospasm, one of the things that they found that correlated with that was if they pre-treated a couple puffs on an inhaler before exercise, but also staying hydrated. When you're exercising, there's a lot of water loss that you don't see through what you exhale. And losing that much water at one time was making that exercise-induced asthma worse. So if you know or you feel like you have exercise-induced asthma, stay hydrated, most definitely.
So when you go to the doctor and they prescribe you an inhaler, is there just one kind of inhaler or are there lots of inhalers out there?
Lots and lots and lots to choose from. So if your doctor prescribes you an inhaler and you don't feel like in a week or two that it's working, you need to go back and say, this isn't doing it for me. I'm still thinking about my breathing all day long. There's so many to choose from. And right now the big thing is combination therapy. But even that, there's so many different formulations. And so keep going back until you get it right.
She's right. There's all kinds, and not just inhaler. There's a pill called Singular. There are many, many things that are used for asthma control, and it really depends on what's going on with you. Some of your blood markers are really important, and of course, all of your symptoms. Now, recently around the United States, we've had a lot of wildfire smoke from East Coast to West Coast, all the way north down to the south. And so that's really caused a lot of people to have a lot of asthma symptoms over this last year. And for that, we recommend staying indoors as much as possible. You can't get away from that wildfire smoke, so you have to do your best to stay in an environment with cleaner air.
Even without wildfires, if you're walking or working near traffic, if you live near a really busy street, there's a lot of apps that you can put on your smartphone that will tell you what the air quality index is for the day. And if it's really bad, then stay in or wear a mask if you go out walking.
And you know, if you guys have more questions about different lifestyle modifications on how to manage your asthma and manage your breathing in the fall and in the winter, in the spring with all the different allergens, please check out season 1 too, because we have lots of different episodes on how to manage your breathing in the cold, with allergies, with the heat. We go into what to do during the holiday season when there's lots of people around you and there's germs everywhere. So please check out season 1 too for some more different modifications, how to get ready, how to sleep properly and make sure your breathing is protected at night. So we go through a lot of that in season 1. We don't want to bog these episodes down too much with all of that. But definitely check those out, because those are some really great resources and more specific topics on maybe some particular times where you notice that your breathing is a little bit worse.
Now, over and over and over, we've talked about the action plan, and that's the communication plan from your doctor on how to put all of these things into play. And so having an action plan is super important. We have a whole episode of that on season 1, but just knowing when you have an acute flare-up, what do you do? What do you grab? Which inhaler? And what should you do? Some people are on smart therapy. Some people have 2 different inhalers. There's lots of different choices for asthma. So knowing your plan is super important.
I'm going to pull up a quick asthma action plan. So here's an example of an asthma action plan. And you don't need to memorize this. This I downloaded from the internet from Asthma and Allergy Foundation of America. They're free. This is a paper that you take with you to your doctor's office, and you work with your doctor and say, if I feel short of breath, what should I do? What should I do to maintain normal breathing? If I feel short of breath all of a sudden, or it gets really bad, what should I do? And those are conversations that you have with your doctor or your healthcare team or whoever to decide, well, should I just take a couple of extra puffs on my inhaler? Or at what point should I go get seen or call somebody? Because most of our patients that land in the hospital are patients that didn't have an action plan, and they waited and waited and waited and waited, thinking they could just tough it out. And now they're in the ER.
Now, if you're a parent of school-aged kids with asthma, you need to have an asthma action plan on file with a school nurse. I have 2 of them over here in my bag that I need to fill out for my 2 asthmatic kids. That being said, the nurse does have inhalers on hand. In my state, there's an Illinois action plan in which they have inhalers for the school nurses. And so some of that is out there. But still, everybody must be informed on what the action plan is for each individual.
Well, I think that just about covers it for the basics on asthma. So I hope you guys enjoyed this episode, and I hope it gave you a basic rundown. And again, if you want to get further into how to manage that shortness of breath in very specific situations, check out season 1, because there may be some more specific episodes on all of those different types of things. So thank you so much for joining us, and we hope to see you guys in the next episode.
Thanks for joining.
I look forward to reading your comments. Hi, friends. This episode of the Cozy Lung Lounge is brought to you by Hootenanny Joy, where your health and wellness take center stage. At Hootenanny Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootenannyjoy.com to explore the programs and choose the one that fits your journey best. Hootenanny Joy, because your health deserves a little joy.